Namaste. Today we shall be discussing about benign and malignant tumors difference. Cancer is a kind of disease in which the cells start growing in uncontrollable manner. Whenever the tissue or any cells start growing in uncontrollable manner, they start making nest of cells. Now these cells can be benign, that is non-cancerous, or malignant, that is cancerous. So there are certain differences by which we can differentiate between benign and malignant tissues. Benign tissues are usually non-malignant and they grow at a slower pace, whereas malignant tissues are cancerous and they grow at a faster pace. If we see clinically, benign tumors are smooth, they are well capsulated and they are usually not attached to deeper structure, whereas malignant tissues, they are irregular, usually non-capsulated, and they are usually attached to deeper structures or surrounding structure. Benign tissues, they don't have tendency to infiltrate into surrounding tissues, whereas malignant tissues, they have tendency to infiltrate into surrounding organs or tissue. If we talk about the infiltration of lymphatics and blood vessels, benign tumors, they don't infiltrate blood vessels or lymphatics, and hence they do not metastasize to distant organs, whereas in malignant tissues they have potential to infiltrate vessels, lymphatics and blood vessels, and they reach to distant organs. The benign tissues, they are usually operable and after surgery they don't recur, whereas malignant tissues, they are also operable in early stages but they have tendency to reoccur. When we see the histopathology, benign tissues are usually well differentiated, whereas malignant tissues can be well differentiated or moderately differentiated or poorly differentiated. In benign tumors, while naming them, we usually add OMA, for example, lipoma, fibroadenoma, etc. Whereas in cancerous cells or malignant cell, we usually add carcinoma or sarcoma, for example, squamous cell carcinoma, adenocarcinoma. So, benign tumors clinically, to start with, they are without any symptom, but as they grow, they may cause pressure symptoms because of the pressure on the surrounding tissues without infiltrating. Similarly, malignant tumor, they also have pressure effect, and after a certain point of time they start infiltrating. So these were basic bullet points how we can differentiate between benign and malignant, and definitely the prognosis varies between benign and malignant tumors. Benign tumors are usually, they have good prognosis once treated, whereas malignant tumor, their prognosis depends on the type of histopathology, the type of malignancy and the stage of the disease. Namaste.